In the quest to understand the complexities of the human mind, some scientists and psychologists study the depths of the nervous system and its connections to our behaviors. We hear a lot about the nervous system these days with the emergence of this research as well as trauma-informed care. We hear stuff like regulate the nervous system or calming to the nervous system. But what is the nervous system exactly, and how can we understand such a complex system that is interwoven with other systems inside the body and even environmentally? The nervous system is like the body's control center. It's made up of the brain and spinal cord, which are called the central nervous system, CNS, and all the nerves that spread throughout the body, called the peripheral nervous system, or the PNS. The brain is the big boss of the nervous system. It's in charge of things like thinking, feeling, and moving. The spinal cord is like a superhighway that carries messages between the brain and the rest of the body. The peripheral nervous system has two main jobs. The somatic nervous system, which controls the stuff we do on purpose, like moving our arms and legs and feeling things with our skin. The autonomic nervous system takes care of things we don't even think about, like breathing and digesting food. Nerve cells called neurons are the building blocks of the nervous system. They send messages using electricity and chemicals. Neurons are like tiny messengers that talk to each other in order to make things happen in our bodies. The brain has different parts, each with its own job. The cerebrum is the thinking part. The cerebellum helps with balance and coordination, and the brainstem keeps everything running smoothly. Overall, the nervous system helps us do everything from thinking and feeling to moving and breathing. It's pretty amazing how it all works together. Today, we delve into the emerging research field of neurobiology and suicide. We will take a look at the serotonergic system's intricate role in suicidal behavior and learn a lot about the brain along the way. The serotonergic system, a pivotal component in our brain's vast network, plays a crucial role in regulating mood, anxiety, and decision-making. The major players are serotonin receptors. Think of these as tiny receivers in your brain. They're like antennas that can pick up signals sent out by a neurotransmitter called serotonin. Serotonin transporter. This is like a transporter or shuttle in your brain. Its job is to move serotonin molecules from one place to another, kind of like a bus carrying passengers. Tryptophan hydroxylase enzyme. This enzyme is like a factory worker. It helps to produce serotonin from another chemical called tryptophan. Tryptophan is an amino acid that your body gets from food, and this enzyme helps convert it into serotonin, which is important for mood regulation and other functions. Now imagine a dance party happening in your brain. Serotonin, the neurotransmitter, is like the music that sets the mood. The serotonin receptors are the dancers who respond to the music, and the serotonin transporter is like the DJ who controls the flow of music around the dance floor. The tryptophan hydroxylase enzyme is like the chef in the kitchen, cooking up more serotonin to keep the party going. So when everything is working smoothly, serotonin gets released, binds to its receptors, and makes you feel good. The transporter moves serotonin around as needed, and the enzyme keeps making more serotonin to maintain the party atmosphere. But if there's a glitch in any of these parts, it can really affect your mood and other brain functions. Research has unearthed potential links between this system and suicidal behavior. Notably, 5-HT1A receptors, akin to molecular switches, exhibit heightened activity in individuals who face major depression and died by suicide. 5-HT1A stands for serotonin receptor subtype 1A. Serotonin receptors are proteins located on the surface of cells in the brain and other parts of the body. They play a crucial role in transmitting signals between nerve cells or neurons and regulating various physiological processes including mood, appetite, sleep, and cognition. The 5-HT part of the name refers to serotonin, which is sometimes abbreviated as 5-HT. The 1A part indicates the specific subtype of the serotonin receptor. Imagine 5-HT1A receptors as tiny switches in your brain. They're like light switches that control how your brain responds to serotonin. Now, in people who experienced serious depression and sadly died by suicide, these switches are flipped on more often than usual. It's like the lights are stuck on, making their brains overly sensitive to serotonin. This heightened activity of these switches might contribute to the intense feelings of sadness and hopelessness that can lead to such tragic outcomes. Tryptophan hydroxylase and the serotonin transporter also draw attention, the latter showing reduced activity in critical brain regions responsible for decision-making in those who die by suicide. Think again that the serotonin isn't getting where it needs to be in the correct amounts. Our journey doesn't end just with serotonin. The noradrenergic, the dopaminergic, and the glutamatergic systems also offer clues. The noradrenergic system. This is like another set of messengers in your brain. They help regulate things like attention, alertness, and stress responses. Dopaminergic system. Think of this as your brain's reward system. It's involved in feeling pleasure and motivation. Dopamine is often called the feel-good chemical. Glutamatergic system. This is like the communication network in your brain. It's involved in learning and memory, among other things. From altered receptor activity in emotion and cognition centers to potential variations in dopamine and glutamate, the puzzle of suicidal behavior is far from solved. Furthermore, the GABA and cannabinoid systems reveal variations in those who die by suicide, hinting at the broad spectrum of neurobiological factors at play. GABA system. Think of GABA as a calming agent in your brain. It helps to reduce activity in your nervous system, kind of like a natural tranquilizer. When this system isn't working properly, it can lead to feelings of anxiety and restlessness. Cannabinoid system. This system responds to compounds found in marijuana and also produces its own natural chemicals. It's involved in regulating things like mood, appetite, and pain sensation. When scientists study the brains of people who die by suicide, they notice differences in how these systems function. It's like the switches that control GABA and cannabinoids are either turned up too high or too low. These variations can contribute to changes in mood, thinking, and behavior, making it harder for some individuals to cope with stress and emotional challenges. Suicide, a multifaceted and deeply personal tragedy, cannot be explained by neurobiology alone. Yet, understanding these brain mechanisms offers a beacon of hope. For every question answered, we edge just a little closer to prevention and intervention. Remember, knowledge is the first step towards change. Stay curious, stay informed, and most importantly, stay compassionate.